This video is about gluten sensitivity. So, how common do you think it is, and what are the symptoms? So, the first thing you need to know is, what is gluten? So, gluten is the name of a protein found in 3 grains. These are going to be wheat, rye, and barley. So, there are two main conditions associated with gluten, that being non-celiac gluten sensitivity and celiac disease. Celiac disease impacts about 1% of the U.S. population, and that is when they have the characteristic pathological changes in the digestive tract. 1% has that. And it's thought that up to 6%, and it could be less, could be more, have non-celiac gluten sensitivity. That's a lot of people. How many people is it anyway, if you were to do the math off the top of your head? So think about that while we look at the symptoms that patients typically present with who have non-celiac gluten sensitivity. They can have these same symptoms if you have celiac disease. The difference is, of course, the pathology changes in the gut. So this chart was based upon a study that was done at the University of Maryland in their Center for Celiac Research. Almost 6,000 people, almost 350 satisfied the non-celiac criteria, the non-celiac gluten sensitivity criteria. That's about 6%. So let's do the math. 6% of 330 million people is 19,800,000, which is basically 20 million people. 20 million Americans suffer from non-celiac gluten sensitivity, which means they are manifesting one or more of these symptoms that is not responsive, not getting better after whatever treatment is being used for them, because the treatment needs to be getting rid of gluten. So imagine how many people, who knows how many millions of people there might be who have depression caused by gluten, which means that antidepressants are just doing nothing for them at all, except potentially creating side effects from taking the antidepressant medications. So multiple common symptoms, and you watching either may have one or more of these yourself that's not going away, and you may have friends, family members, patients who do as well. So you can do a blood test to identify gluten sensitivity, and there are various levels of an expense that you can do. The easiest way, I think, is what I describe in the Deflame Diet book in the gluten chapter, and I call it the potato test. And that is when you challenge your body with eating a potato that contains no gluten versus challenging yourself with gluten. And then that will bring out the symptom and be pretty solid evidence that you do or do not have gluten sensitivity or celiac disease. So easily described in this book, as well as other markers of inflammation that should be tracked. So you can pick up this book at Amazon, along with my other books, as well as you see here. It is this book that describes the potato test in the gluten chapter. I mentioned gluten in some of these other books, but the big discussion is in the Deflame Diet, the original Deflame Diet book. So you can get individual copies at Amazon, and you can get volumes at my website, deflame.com. And if you're there, you can go right through to Facebook and follow Deflame Nutrition Facebook for updates. And of course, right now you're watching the video, you can just click subscribe if you wish.